Welcome to the Eyecare Experts. I'm Dr. Bell, Dr. Terrezza, and we've got with us a new face, but maybe not a new face altogether. Some may recognize from the past, but we have with us Dr. McDonald. Welcome to the podcast.
Thank you.
And I guess before we get going, and we've got some topics we're going to go through today as far as the podcast. Tell us a little bit, I guess, where you went to school maybe, background a little bit, anything you feel pertinent that the patients and viewers would like to hear.
Alrighty. Well, I'm an Air Force brat, and my family retired here in the Panhandle back in the late 80s. And then I went on to get my undergraduate degree at Florida State, and then went down to Miami to attend optometry school at Nova University down there in Miami. And then when I graduated, we'd moved up to the Fort Lauderdale area. And then I've worked in private practices in a large ophthalmology group down in South Florida before coming back up this way in 2010, which is when I first joined Dr. Terrezza's office. And so I've been working up here in the Panhandle since 2010.
Yep. And I work mainly at the Fairfield office most days, and I certainly see patients that you saw, certainly seeing your name on the chart and everything like that. So as far as you live, where do you reside or live?
I currently live in Navarre. My son and I have a 16-year-old who goes to Navarre High School, and we moved to Navarre in 2013 and have been living out there along the beach since 2013.
And speaking of that, certainly she's going to be joining us at the Navarre location, I think in Milton as well. But Navarre, our newest office, had just opened. You'll be starting, I think, in about 3 weeks, maybe August 18th, something like that, first day. But we're lucky to have you. I know you live there, and the residents and patients that live there will know your name and certainly come see her at Navarre. We take all vision, all medical insurances. And it's a good place to get in there. We've got the space we need, and we appreciate you.
Oh, I'm excited to be there, and I can tell you, having lived out in Navarre for the last 13 years, that this practice is much needed, and that I know so far a lot of the locals are really excited to have Dr. Terrezza open up an office and for us to have the option for another eye care facility out there in Navarre. That was something that was truly lacking, so it's exciting to have this.
Well, we're glad. We've been trying to make this happen. It seems like over 2 years for a while. It hasn't been easy to get into Navarre.
Well, it's different. You can get a doctor, but to get a seasoned doctor that's from the area, that likes the area, and gets along well with patients, this is a good find. This is definitely a plus for Navarre, and I think they will take advantage of it quickly.
And I think also the one thing about our model is certainly we do glasses, we do contacts, we do all those things, whether it's multifocals or hard lenses, any specialty lenses, but we do the medical stuff too. And there's places where patients will go where they have to go here for this, there for that, and this. And certainly with us, we do pretty much everything, as far as glaucoma, diabetic retinopathy, macular degeneration, high-risk medications. We monitor, manage, treat all those things in-house up until the point where you actually would need surgery, such as cataract surgery or retinal surgery. We would refer you to a specialist for that, but certainly we can monitor and do post-op care in our offices. Because every office has basically an OCT, a visual field. We have all the equipment we need to monitor and watch those things very, very closely. And it helps us. It's best for the patient, too, to be able to kind of notice the slightest changes. And we've talked about this in our past podcast as far as when you can pick up things early and you're proactive, it's usually a better chance for the patient to be taken care of and less risk to have something that becomes permanent.
Well, also, this is letting the cat out of the bag, so to speak, but soon we should be associated with a large research facility and be licensed to perform clinical investigations on many medications. And we are forming a conglomerate to do that, and more on this in the future. But I'm very excited about that, and we'll see.
Yep. Future looks bright. Well, the topic for today, we're all going to kind of weigh in on this, especially with kids going back to school. We're almost there. Everybody's
2 weeks.
Yep, we're close. We're close. So if you need an exam, certainly try to get in. Give us a call now because we do get busy, and the schedule does fill up certainly right before school starts. But today we're talking. We want to talk to basically patients, talk to parents. Why should kids come in for an exam? Things to look for. What are issues? Things you should be noticing. All those good things. So I guess, and this could go to either one of you guys, what do y'all usually tell parents as far as, hey, maybe things to watch for, things to look for, why their kid may have a visual issue or something like that?
People are always, I hear a lot, I know my kid can see, or I didn't bring them in for an eye exam because I don't see them squinting, or I don't see them standing on top of the TV or something like that. So I know they have good vision, and then we find out that they really don't have good vision. There's so many other things that can be going on. They could have issues with their depth perception. They can have issues with concentration and focusing in school, not just visually focusing, but staying on task and being able to concentrate on what they're doing. Squinting when they go out in the sun, rubbing at their eyes a lot of times, things like that that can be signs of visual problems that parents aren't necessarily looking for. So it's really important, because just a screening at the pediatrician's office or the VPK screening at school or whatnot will sometimes pick up visual issues, usually something for more of a distance or nearsighted type of problem going on, but it won't always pick up the kids that are farsighted or have astigmatism or binocular vision problems and that sort of thing.
No, that's an excellent point. I do think school screenings have gotten better through the years, but to your point, it doesn't pick up everything. So, when we go through and do a full comprehensive exam, we're checking vision at distance, we're checking vision at near, but we're also individualizing, checking each eye, because I have a lot of kids who come in and they'll say, and the parents will say, hey, he's seeing fine. But when we break it
Not out
down,
of
one
this
eye's
eye.
seeing good and the other one's not.
Right.
And the longer sometimes that stays, and it can become a lazy eye, it's harder to correct over years and years of the patient not using that eye or something like that. So that's certainly reasons to come in. I mean, it's nice for me to sit here and say, everything looks good, you don't need glasses, but there's a lot of kids that certainly could benefit from wearing something, or, have an issue that may not be glasses related, that maybe they need some therapy. Maybe we need to do some eye exercises. There's a lot of things that we need to do.
Right.
And one of your favorite things you say is, and we want to point out, poor vision in schools. How can poor vision impact learning, reading, development, and behavior in kids?
Oh, it's incredible. One of the, I guess unfortunate, but it's hard to say that word, that people can't see. They'll read a 20/20 line, but because the eye is able to focus itself, they're merely doing the work themselves that makes up for the defect that they have, but in fact, they're struggling to do that. So their reading speed goes way down, their comprehension ability, which is a function of the reading speed. So with the difference in ability to comprehend things being a function of speed, so you talk at one speed, you read at one speed, you see at one speed, and your brain processes information at a speed. So that's why you tend to lose attention when in fact you're not getting the information into the brain. She'll just start wandering off and think about what you're going to have for lunch today or some other thing, because it doesn't have enough information coming in to keep it occupied. And that can happen with a lot of prescriptions or kids that need prescriptions that aren't fully corrected. And so they're very difficult to detect in a screening because they're farsighted. That is, the eye can make up the difference itself. So it's subtle, and those need to be detected too.
Yeah, there's a lot of kids that are actually misdiagnosed with an attention deficit disorder or a problem with their mental focus, and it's really not a true attention deficit problem. It's a visual focus that leads to the attention deficit. And if you've got a child that has a hard time staying on task, they won't sit still in their classroom and focus on what's in front of them, and they're looking all over the place and fidgeting and staring off out the window and things like that. A lot of times that's just because of an undiagnosed vision problem. And once you get that kid in some glasses and maybe vision therapy if it's needed, totally different student. Their schoolwork improves, their learning comprehension improves. As Dr. T said, their reading levels improve, and it's approximately 80% of kids who have learning disabilities actually have a vision impairment that's going along with that. So if we can fix the vision side of it, you can really help your student tremendously with their learning in school.
And I see that. I think sometimes kids, especially the young kids, can't vocalize or don't understand that they're having an
Right.
issue, and they just avoid doing something because either
Yeah.
they're embarrassed or they don't know any better, and so they just avoid a task. They don't do their homework. They don't look at this long because it hurts them. And then, to your point, once we get that corrected, there's definitely a big
And
change.
it affects them socially, too. They are not always as interactive with the other students in class. They don't want to participate in activities. It can affect them with, outside play and sports and all types of things. So it's not just learning, it's the whole, well-being of the child can be affected just by not being able to see well.
It hurts their self-esteem, and once you crush that, that's very hard to build back. It's easy to tear down, but very hard to build back up, and that has ramifications for the long term, which is harsh.
Well, the question I get asked a lot by parents, especially in the exam room, and I'll just answer it and see if you guys agree or disagree, is the question of what age. I have, my 18-year-old is here, but I have the 3-year-old or 2-year-old at home. What age should I bring my kid in for that full comprehensive exam? And my answer is usually if everything looks good, I'd like to see them, especially before they start pre-K or kindergarten, age 4 or 5, I think is ideal. But I'll also say to that, if there's anything concerning, whether it's, walking close to the television, not seeing something they should, eye turn issues, anything like that, we see kids of all ages. It doesn't matter if they're 6 months, 1 year, 2 years, bring them in, because with those kids, and that's kind of how the whole infancy program got started, especially with strabismus and eye turn patients, is the earlier we catch those patients, the better we have to correct them and to get them on the right track, the longer it stays, so that's a stay there that long. So, if there's any question, we'll see, bring them in. We'll see them, but if everything is good, I usually say age 4 or 5. Do y'all say anything different or disagree with that, or what do y'all think?
I'm like, usually by the time they're heading into preschool, it's time to get them in, whether you've noticed anything or not. Let's get them set up for success, at that age once they get into the school setting.
One of our doctors likes to see patients younger than that.
Yeah.
There's 13 of us, by the way, and so
Man.
each likes their little niche and has their own little ways. But if you have problems, particularly if it's on an insurance that you have trouble getting seen with, we take 99% of those insurances. And we have a full insurance department that figures all that out for you.
And the other question I get is, well, how in the world can you check vision on a 6-month-old or a 1-year-old or a 2-year-old? And there's ways to do it. I know in the, the traditional sense, we, ask patients better 1 or 2, but, we have autorefractors, we have retinoscopes, and there's ways we can figure out what the prescription is. Because I have adults sometimes that are that can't speak, nonverbal, autistic kids. So it's not always kids. I mean, it's adults too, where we have to figure out the prescription, and there's ways to do it. So, I get that question, like, how can you do this? But we can figure it out.
And don't worry if your kid doesn't know the alphabet yet. I have parents say, well, we don't know the letters yet, so we can't do the test. We have options for pictures and numbers and shapes and other things that we can use if they are able to recognize that. So if they're not up to speed on the alphabet, don't worry about that. Still bring them in.
Yep, for sure. And, we're talking mostly about full comprehensive exams today, but we do, office visits, red eyes, infections, any eye injury, give us a call. We want to see them, make sure they're taken care of. We do all of that. As far as one thing, do you remember the percentage you used to say as far as how much learning is visual?
Oh, it went from 65%.
75, I think, right?
25 years ago. It's at 80, close to 80 to 85 now. So that means if you're visually impaired in any way, you're going to miss on 85% of all input. Well, that's a crazy number. And so
It is.
you're too restricted. It's too, it's too linearly, it's too vertical. You should have it's like stocks. You should have a little bit of everything, a wide portfolio, as opposed to depending just on vision to take stuff in. But that's the way our society is now, and that's what we do.
I mean, we want to try to give everybody an advantage that we can, and with those kids that really need help, and they, that's kind of like they're already working at a disadvantage as far as learning to begin with.
There's about 25% of kids that have vision problems too. So it's 1 in every 4 kids is going to have a vision problem. So definitely it's not a low number of children that have issues with their vision.
And the other thing is we do a lot of sports goggles. I mean, there's a lot of kids who play baseball, football. Sometimes we have to figure out, what will fit on the inside of that helmet, things like that. And for older kids, we offer contact lenses. I know for me, I played baseball, and playing baseball and football, especially when I was 14, 15, 16, contact lenses really helped me out. So we fit all those. We're not married to any brand. That's the good thing about us. We're private. We own it. So we can fit patients in any contact lens. Whatever's best for the patient, that's what we're going to try to do.
That's a big differentiation point with a lot of opticals that are corporate in nature, and therefore have certain channels that they buy. Their vendors are all restricted, and they can only do certain things. It's kind of like insurance. You go to a State Farm agent, you buy State Farm. With us, we just get what's across the board. That's the way pharmacies used to be.
And I enjoy it. I guess we've been doing this a while, so a lot of the patients are older patients. I love seeing the kids. I tell you, it's a breath of fresh air to come in, especially to see the kids are, starting school or doing this or that, or, playing in the band or playing sports. So certainly come in to see us. Go to TerrezzaOptical.com. How many locations we got now?
8.
Eight locations. So certainly around the Pensacola area, we've got 2 in Alabama, and we just opened up, again, our newest location in Navarre, and then before that at the Baptist Hospital right there at the Henderson Building. We take, as we said before, we take pretty much every vision medical insurance. So, give us a call. If we can find a medical diagnosis, we could be your medical insurance. But we thank you for listening to our podcast, and that's the reason we do this, is for you guys. Thanks, Dr. McDonald, for joining us.
I'm excited to be here.
Yep, come see her in Navarre. We're glad to have her, and we appreciate it. Stay tuned for future podcasts. Thank you, guys.
Appreciate it.